Hi, Mr. Brown. My name is Miranda. I'm going to be doing a neck and heart assessment on you today. Due to privacy, the patient will leave his shirt on, but if we were in a hospital or doctor setting, the shirt would be removed and the assessment would be done on skin or under a hospital gown. First, I'm going to assess for jugular vein distension. The patient should be positioned at a 30 or 45-degree angle, and please turn your neck to the left side. A normal finding is that there would be no jugular vein distension. If there was a jugular vein distension, this may indicate an increased central venous pressure, which could also cause cardiac tamponade, pulmonary hypertension, and right-sided ventricular heart failure. Next, I'm going to palpate your carotid pulses. The carotid pulse is located on either side of the trachea. I'm going to feel for the strength, which should be a 2+, and also a smooth upstroke. A weak pulse would indicate hypovolemia, shock, or decreased cardiac output. A weak pulse would also be considered a 1+. Next, I'm going to auscultate your carotid pulses. I'm going to use the bell of my stethoscope will be placed over each side. I will listen for any blowing or swishing sounds, which could be considered abnormal. I'm going to ask you to take a deep breath in, out, and hold it for me. And again. Good. Only the pulses should be heard. There should be no abnormal sounds such as blowing or swishing. Next, I will inspect the precordium. I will look for any pulsations or any movements other than normal respiratory patterns of inhalation and exhalation. The apical pulse is located on the left side at the midclavicular line at the 4th or 5th intercostal space. If the pulse is hard to hear or the patient is obese, you can lay the patient on their left side and you should be able to palpate the apical pulse because the heart becomes closer to the chest wall. I'm now going to auscultate your heart. I'm going to start at the aortic area, which is at the 2nd intercostal space on the right side, or also known as Erb's point, onto the right side. I'm going to move over to the directly on the left side and listen to the pulmonic area. Just below the pulmonic area, still on the left sternal border, is Erb's point, which is located at the 3rd to 5th intercostal space. Just below Erb's point at the 4th to 5th intercostal space, still on the sternal border, is the tricuspid area. At the 4th to 5th intercostal space, but at the midclavicular line, is the mitral area. An easy way to remember the correct areas to listen for heart sounds is ape to man, aortic, pulmonic, Erb's point, tricuspid, and mitral. The patient had normal neck and heart vessels assessment. There was no visible jugular vein distension. The carotid pulses were considered a 2+ with a normal upstroke. I now have completed my assessment.